The Discyphor direct catheter system for the functional anesthetic discography procedure is the first fundamentally new technology for diagnosing low back pain. It delivers a new and unprecedented level of information regarding the source of low back pain by allowing both functional and anesthetic assessment. The Discyphor direct catheter system is the next generation of diagnostic technology for deciphering low back pain in a whole new way. The functional anesthetic discography procedure, also referred to as the FAD procedure, involves the placement of the Discyphor direct catheter into discs suspected of generating pain. Fluoroscopic guidance should be used throughout all procedural steps related to needle and catheter placement.
The Discyphor direct catheter system includes an 18-gauge outer needle with a quinky point that is available in two lengths, 3.5 inches and 5 inches. The system also includes a 20-gauge inner needle, which is designed with a pencil point tip to minimize disruption of the fibers of the annulus. It is also available in two lengths, 7 and 8 inches. Place the outer needle via a posterolateral approach, taking care not to penetrate the outer fibers of the annulus. Once the outer needle is in position, remove the stylet. Advance the inner needle through the outer needle and into the nucleus. Remove the stylet once the inner needle is appropriately positioned in the nucleus. The flexible Discyphor direct catheter includes two lumens. The longer lumen, referred to as the injection lumen, allows for delivery of anesthetic or saline into the disc. The shorter lumen, referred to as the inflation lumen, allows for inflation and deflation of the balloon at the distal tip of the catheter. The catheter is color-coded to monitor catheter insertion and facilitate system assembly. When inflated, the balloon maintains the position of the catheter within the nucleus. Carefully advance the catheter through the inner needle into the nucleus. Slight resistance will be felt when the catheter reaches the exit ramp at the distal end of the inner needle. This positioning can also be verified through the yellow and green color transitions on the catheter. After radiographically verifying that the tip of the catheter is properly positioned within the nucleus, remove the outer needle and inner needle simultaneously while keeping the catheter in place. The Discyphor direct catheter system includes several components that are pre-assembled to facilitate interoperative system assembly. The stopcock assembly is composed of a stopcock and a Tui Borst with a wing nut. The wing nut is colored blue to match the color of the inflation lumen of the catheter. The balloon inflation assembly consists of a 3 cc syringe and a pressure relief valve. The pressure relief valve is designed to release excess fluid, thus preventing overinflation of the balloon. The injection assembly is comprised of a Tui Borst with a wing nut and a one-way valve. This wing nut is colored white to match the color of the injection lumen of the catheter. The one-way valve ensures delivery of anesthetic or saline into the nucleus by preventing it from flowing back into the syringe. Attach the stopcock assembly to the blue inflation lumen on the catheter. Attach the balloon inflation assembly, pre-filled with radiopaque contrast, to the stopcock by tightening the hub of the pressure relief valve. First, pull a vacuum with the syringe, and then slowly inject the radiopaque contrast through the inflation lumen to inflate the balloon. Close the stopcock while maintaining moderate pressure on the syringe plunger. Confirm inflation of the balloon via fluoroscopic imaging. Remove the balloon inflation assembly from the stopcock assembly and attach the white end cap to the stopcock. Attach the injection assembly to the white injection lumen of the catheter. Secure the catheter to the patient using the EpiGuard and the adhesive clips. Attach the adhesive clips to the Tui Borsts prior to affixing the clips to the patient's side. Repeat these steps at all levels that need to be evaluated.
The functional evaluation portion of the FAD procedure is performed once the Discyphor direct catheters are appropriately placed into the disc under evaluation. The catheter is used to deliver anesthetic into the disc. The inflated balloon at the distal tip of the catheter helps to maintain the position of the catheter throughout the functional test.
Once the patient has recovered from any sedation used during catheter placement, instruct the patient to perform a specific activity that typically generates his or her pain, for instance, sitting or bending forward. Record the pre-injection pain score and applicable range of motion as a baseline. Inject an appropriate volume of injectable anesthetic, such as lidocaine or bupivacaine, into the disc through the injection assembly. The patient may exhibit a provocative pain response to the injection due to pressurization of the disc. After allowing sufficient time for anesthetic onset, instruct the patient to perform the same pain-generating activity previously performed and record the pain score and applicable range of motion. If there is no improvement in range of motion or noticeable reduction in pain, it would suggest that this disc is not the source of the patient's low back pain. The next suspected disc may be assessed at this time. Inject an appropriate volume of injectable anesthetic into this disc through its corresponding injection assembly. After allowing sufficient time for anesthetic onset, instruct the patient to perform the same pain-generating activity previously performed. Record and assess the pain score and applicable range of motion. If there is noticeable reduction in pain or improvement in range of motion, it would suggest that this disc is a source of the patient's low back pain. Upon completion of the functional evaluation, the catheters must be removed. Connect a syringe to the stopcock assembly. Open the stopcock and deflate the balloon by pulling a vacuum with the syringe. Leaving the stopcock open, slowly remove the catheter from the patient.
The functional anesthetic discography procedure with the new Discyphor direct catheter system can help to confirm the source of chronic low back pain. This may assist you in selecting the most appropriate treatment options for your patients.
The Discyphor direct catheter system, deciphering low back pain in a whole new way.